I love my job wholeheartedly. I tell them every day. As a child, I always had aspirations of becoming a physician's assistant. So upon entering the program, I was paired with a physical therapist in which reached out to many different people. And one of the people, many different people she reached out to was a physician's assistant. And he introduced me to the field of nursing. So when I was at DePaul, I shadowed respiratory therapists, radiologists, cardiologists, physical therapists, even behavioral therapists. And throughout my tenure, I kind of narrowed down the selection of what I wanted to enter into the field of medicine. And in the medical arena, I ended up deciding to choose the route of nursing. So in the summer, I had a position in which we were focused on primarily incorporating youth into the workforce. And we wanted to show youth that they can get their foot in the door at a hospital or a location without necessarily having acquired that degree quite yet. Some of the youth that were in the program were offered positions with Cardinal Glennon. So a member, Anaya Anderson, which was the supervisor of our project, she was offered a position as a clinical partner and a patient safety attendant. And I was also offered a position as a clinical partner and a patient safety attendant. I actually just received another offer as well. So the sky's honestly the limit with St. Louis Youth Jobs. The other offer that I've just received that I went ahead and accepted as of yesterday is an emergency department technician. So I'll be working in the emergency department in a level 1 trauma unit at Cardinal Glennon. And I will be primarily stocking cards, checking vitals. I have a lot of training that I have to go through. They're helping me so much. I love them. They're so great. But I have a lot of training that I have to go through. And I'll be making sure crash carts are ready for patients, checking IV poles, being a handyman, doing the footwork for nurses, running things to different floors, things of that nature. As a nursing major, it literally helps me infinitely almost. I'm surrounded by nurses of all levels of experience throughout the whole entire day. So I'm surrounded by pediatric trauma nurses. I'm surrounded by oncology nurses, respiratory nurses. I'm surrounded by doctors, physicians. I'm surrounded by physician's assistants. So me being actively surrounded by nurses every day helps me for clinical. It helps me understand how to communicate with patients. It helps me understand how to process information, how to process paperwork, documentation. It teaches me, I'm learning how to do vitals. So I've never done vitals before in my life. It was a completely new thing to me. I saw it in the job description. I was a little nervous. They assured me not to be nervous, to be calm, and that they would teach me, and that they would help me and assist me and show me how to acquire vitals from a patient. So there's many. I'm surrounded by nurses all day. Entering a nursing major is perfectly practical for the field that I'm entering one day. My job coach this summer, so she went out of her way tremendously, and she helped me with my resume. She helped all of my work experience that I had. It wasn't formatted, it wasn't documented at all, and she kind of went ahead and made an official resume, which I never had before, and it was appreciating. But this prior summer, Miss Jerica Robinson, she literally reached out to Cardinal Glennon. She had mentors assigned to each member of our program, each member of our group. So one of our people, Lauren, she just graduated with her degree. She wants to go on medical school, so she was paired with a medical doctor at the facility and location. So it helped. I was paired with the nurse here, Miss Kishka Jackson. So it helped. The job coach, she literally goes out of her way every time on our behalf to help us acquire workforce experience that we wouldn't have otherwise, basically. In the long term, I honestly hope to be working with Cardinal Glennon. So right now I have, I guess, technically 3 positions with Cardinal Glennon as a patient safety assistant, a clinical partner, and the emergency department technician. And I was speaking to one of the nurses on the floor, and she wants to go ahead and offer me a position as a nurse in the emergency department upon graduation and upon acquiring my licensing. I've loved my short tenure here. Today actually was a wonderful day. I have drawings from the kids. We were drawing pictures and stuff like that in the classes, and we were laughing, giggling. It's been a good time today. So I love that face-to-face interaction with kids that honestly they do need it. These are suicidal patients, patients who have attempted suicide, who have experienced traumas in their lives, unbeknownst to a lot of people. And so these are often people that are forgotten. So just being here with them, it honestly means the world to me. My mom lives right across the street. So I take pride in this neighborhood, in this community, and being able to actively heal it. So in the next few 5 to 10 years, I honestly see myself working with Cardinal Glennon.